Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you notice, I started out with my mask on. I want to make sure that everyone recognizes the fact that we still have this insidious COVID-19 viral agent around. You've got to wear your masks, and you got to wash your hands and make sure that you are socially distant correctly. We have a very, very interesting show. This is about convalescent plasma and Nurse Connect at Broward Health, and a return visit from Dr. Rafael Bustamante, who is a vascular surgeon. And we also have Shannon Heiss, who is a lead nurse at Nurse Connect program at Broward Health. Dr. Bustamante, how are you?
I'm doing well, thank you. Thank you for having me.
Dr. Bustamante, I know that you are a preeminent vascular surgeon, but let me refer to you from the very beginning as a COVID-19 survivor and a convalescent donor. So give us some words about your experience.
Essentially, I had COVID back in March of this year, so I was very sick for 2 weeks. Came to the hospital a few times, couldn't breathe. The whole experience. Me and my wife had it as well. Fortunately, we were able to recover from that fully. It took us about 2-week course to get better, and after I recovered, I got the opportunity to donate plasma. It was a no-brainer for me to donate plasma because it was very simple to register. All I needed to have is past experience with COVID and be recovered after a certain amount of days. And the experience itself was very painless and easy, unless it was about 35 to 45 minutes to donate plasma, and hopefully I was able to help someone with that.
Would you want to explain to our viewers the importance of the availability of the plasma?
Again, it's very important to have plasma, especially for the patients who are very sick from this in the intensive care unit. Considering that there's no guided treatment at this time for COVID, is more supportive care. I think plasma is one of the few highlights in treatment options for COVID right now. And again, I think it's very important for everyone who had COVID, who got over it, to donate some plasma, at least to try to help those patients that are not so lucky with this.
Yes, well, do I assume your wife is doing well?
Exactly, yeah, we all recovered fully from COVID.
Well, thank you very much. We're very proud to have you back with us. You're a second-time participant in this show, and we're glad to have you. You're a very preeminent vascular surgeon. We'll get back to you in a minute. I'd like to talk to Shannon Heiss, who is the lead nurse, the Nurse Connect program at Broward Health. Shannon?
Hi, thank you for having me.
You want to tell us what a lead nurse is?
A lead nurse is kind of like a charge nurse, takes the lead and organizes everything, makes sure everything's running correctly.
And what is the Nurse Connect program?
We actually started building it back in February. It's a telephone triage program, and we only have ER experienced nurses because they know what triage is, and they quickly over the phone can assess someone with any kind of symptom or medical complaint. And we kind of make a disposition where they should go. Should they go seek immediate care in the emergency room? Can they go to an urgent care? Or can we help them get in contact with their doctor to get their medication refilled? Or do they need a doctor's appointment with their PCP or anything? Or can they manage their symptoms at home?
Does the Nurse Connect program also communicate with a telehealth program that's affiliated with Broward Health?
We are starting to work on that right now, actually.
Yes, I think that would be very, very valuable to your patient population. I believe you would say so, correct?
Yeah, we're really excited to be doing so.
Because we're using telehealth right now at Nova Southeastern, and anything that we could be of help to you on, just perk up and we'll be there to help. Dr. Bustamante, if I can get back to you, sir. Tell me how you are dealing with the situation at the Broward Health system relative to intensive care units, things of that nature.
Again, I think we're actually pretty lucky. We had established good leadership in the hospital system in terms of the administrators, in terms of being prepared for the onslaught of these patients. From the early on, they started converting some of the ICUs into COVID units strictly for those patients. And they stopped the elective cases about a month and a half ago to prevent the influx of patients, to not overburden the healthcare system. So I think the hospital is very prepared in dealing with COVID systems. Luckily we didn't get to the point of it was back up in New York in March, where the hospitals were overwhelmed. But I think we were very prepared in that situation.
Leadership has been rather spectacular in handling the responsibilities you have within your system. I think you would agree to that.
Absolutely. Even in the operating room, we have a COVID designated unit where we take extra precautions of dealing with those patients. Unfortunately, I had to operate on a few COVID positive patients, and safety was first and with my staff. So we ran drills. We did, basically no equipment goes in and out of the no equipment goes out of the COVID room that is not used on the COVID patients, so it's a very robust preparatory system that we have here.
Are you involved with the certified stroke units at all?
No, not necessarily. We're not involved with the stroke units. We have operated some patients who had coagulation manifestations from COVID, but not necessarily dealing with the stroke units.
All right. So the reason I say that is because I know some of the hospitals have had real problems with patients being brought in, 911, et cetera, and then they test the patient, even though the indications are that they might be infected, but then they test the patient, and then the whole system has to react. In other words, a separate area, proper PPE, et cetera. I'm sure that must have been very anxious laden, not for a pro like you, but for the system itself.
No, we have come across plenty of those situations. Just last Monday, I operated on a patient that came in for a completely different situation, but just happened to have COVID on the blood test. We dealt with it appropriately. We have a COVID unit, regular floors where we send the patients, and then once we have guidelines in place and situated and ran with, then those patients were transferred to the operating room on the day of surgery and back to the COVID unit floors. So we have experience dealing with that so far.
Within the OR, and this is maybe an oversimplistic question, but within the OR, because we've had these questions come from our viewers, you have to wear different styles of PPE and shields and things of that nature?
We look like astronauts. We have to wear the PPEs. We have to wear the N95 masks. We have to wear the face mask, different pair of scrubs, everything different. Basically what I go in the COVID room is not what I wear outside the hospital or outside the OR. Stays in, whatever goes in stays there.
Yeah, bless you. I'm so proud of the fact that I know of your work. I know of your work for a long time. And it's really wonderful to know that you have, in quotes, survived this insidious COVID-19. There's a tremendous anxiety feature to the support people that are helping you within the caring of these individuals. Have you seen that type of stress in your venue?
No, absolutely. That goes in the back of our mind every day we go to work. We have families, we have children at home. We're scared to bring this back home. Again, I just got tested again for antibodies a week ago, and I still have antibodies, but who really knows what that means at this time? You know, we're still learning about COVID every single day, a new symptom here, a new symptom there. So I'm still concerned that I could bring this home to my child and my wife.
I was part of a national, I guess you could say, advisory panel last Friday, and we were talking about the problems that are inherent with the merging of, because the time level, everybody said, well, viruses go away during the summer. Doesn't happen that way. Here we are in the hottest part of the summer and still here. But flu season's going to come on very shortly. And it's going to be very difficult, and you tell me if it isn't, for a patient that's brought in and is exhibiting a lot of the dire symptoms of flu, not knowing whether they are COVID or whether they have flu.
Yeah, absolutely. And that's something that we're going to have to figure out once the time comes. But I think we're making advanced preparations in terms from that, implementing new testing guidelines that we have, and making sure that we could separate the COVID patients from the flu patients once that happens. Again, we have I'm very, very pleasantly surprised of how advanced our strategies have been implemented in terms of dealing with the COVID situation here. With the testing, with the guidelines that we have and set to operate on these patients, you know, I think we are on the track of being very prepared for that.
And is the Broward Health System have any of the therapeutics available for the COVID patients?
Again, it would be more impressed to speak with the leadership in the intensive cares for this, but we do have the advanced therapeutics, the antiviral medications, every other supportive care medication needed for this.
Okay, thank you. Shannon Heiss, Nurse Connect program with telehealth coming on. I would assume that that's going to be a tremendous opportunity for Nurse Connect to deal with a lot of these symptom issues. Not that you're going to play doctor, but you're going to advise people where they should go relative to their symptoms, correct?
Yes. And we actually we are helping with the COVID testing. So we've been doing it since March when we first started testing.
And where is the testing occurring at the Broward Health facilities?
It's at one of our clinics. It's the Annie L. Weaver Health Center.
Which is located where?
Pompano Beach, in Pompano Beach.
Where in Pompano?
It's on 2011 Northwest 3rd Avenue.
The test issue is a very important thing. I know that you're involved, your system is involved with Broward County in doing the tracing as well. So it's very important to get people tested that are out amongst the general public. Let me ask you with reference to this Nurse Connect program, because I'm getting back to telehealth for a minute. I would assume that a lot of the new technologies, things like getting EKGs and things of that nature, are going to be placed into the telehealth technology program, correct?
Yeah, a lot of the doctors that we actually schedule for are doing telephone visits first. And so hopefully we'll be able to directly connect them at some point. But yes, we're moving forward with that, with telehealth, and we're going to be involved, and I'm really excited about it.
I want to ask you one question. I just thought of it. With knowledge of the fact that when I spoke to Dr. Bustamante, knowing that flu season's coming up, it's going to be pretty difficult for you to discern, no matter what your capabilities are, as to whether someone has the elements of a flu or the elements of COVID. So the question really is, as Dr. Bustamante and I have spoken, I would hope, and I think, Dr. Bustamante, you would check this off as a must, that people need to get flu shots.
Absolutely. Still follow the same precautions as pre-COVID era is maintaining making sure people get their flu shots appropriately. Again, COVID is not here to change our life. Is here that we have to adjust the way we live so we can live with the virus in itself. The virus is not going anywhere. You know, with the magic wand, we have to know how to adjust and live with the virus during this time. Still, we still have to maintain the same precautions we had before COVID in terms of the flu. We still have to make sure that we get the flu shot as appropriate with that, and still come to the hospital if you're still having severe symptoms from the flu associated with it, with that, because again, chances are very low chance that you're going to get COVID in the hospital, because the hospital is actually extra prepared for patients who have that, who have COVID. So that should not keep you away from the hospital if you need help with that as well, and it should not keep you from getting the flu shot.
You know, Dr. Bustamante, I can tell you we have a situation where, according to the entities that are reporting, nationally known internet, I don't want to name the entities, but the epidemiology experts that are telling us that we're getting ready to go into the flu season, but last year less than 63% of the people in our country took flu shots. So that's a real problem.
That's a real problem, and that's a problem that's not associated with COVID. That's a problem that's been here in the pre-COVID era. Again, I could only speak seeing firsthand effects of the flu. You know, coming from the Northeast, you know, the flu was rampant over there, and if people could see a patient dying from the flu, then probably that make them change their mind.
We're able to have you on as a COVID-19 survivor. And again, I want to underscore one more time and I know that you're going to advocate for plasma donating. So I'm going to ask you to just one more time tell people why the plasma is so important.
Plasma is important because it helps patients who are very sick and intubated in the ICUs. It helps them at least have some develop of some immunity against the virus in terms of antibodies to help fight off the infection. So I think it's very important. If it's 30, 45 minutes of our time that we could donate, if we have the ability to that, then I think we should all donate plasma, whoever had COVID again. So I think that's very important to at least help. That's the least that I could do to help.
How and what places are available in the Broward Health system for people to provide the opportunity to receive the plasma? Where do they go?
If you have been sick with COVID-19 and have recovered, that is, you haven't had any symptoms and you felt well for the last 2 weeks or more, check into oneblood.org. There you'll be screened to identify yourself as a potential donor, where donating convalescent plasma can help someone else who's currently suffering from that illness. The benefit for someone who receives the plasma is that it could boost up their immune system to fight that infection so that they can get over it a lot quicker.
We get calls for people who want to get tested for COVID right now. That's what the community is calling us for. They want to, should they get tested? Should they not get tested? Are their symptoms serious? Should they seek medical attention? And the nurses are able to educate them per the CDC and direct them safely where they should go or where they should not go.
All right, because, you know, in a way, I don't want to embarrass Dr. Bustamante, but he's a hero. And the heroic and humane attitudes and presentation of his giving the plasma to help patients that are potentially in very dire need to the point of saving their lives. I would just suggest that there should be more people that can be the heroes and heroines that Dr. Bustamante has shown to us today.
And we will be happy to educate them where they can do that, because there are people who have got over COVID and that would be candidates for donating.
Okay. Dr. Bustamante, I'm back to you now. I know, again, I don't want to skip over the major, I would say, incredible value you are to our community at large with your capabilities as a vascular surgeon. So very quickly, we're down to the last 3 minutes of the show, but I know that you work on some very, very significant minimally invasive techniques. You want to just talk about that for a couple of minutes?
We do a lot of endovascular treatments for limb salvage, for carotids. Again, the procedure I was doing on a COVID patient was to save his leg practically because he was on the brink of amputation. And again, in our hospital is we work through the situation. So we're not going to let COVID stop me from saving someone's leg. And again, we implement endovascular, small little wires, small tiny balloons to go into the tiny, tiny vessels in the leg to open up to save a leg, essentially. So our job doesn't stop because of COVID. It's just we have to find ways to go buckle our chin straps and put our football helmets on and go through it.
On behalf of the community at large, I want to say thank you. Not only because of your knowledge and your humane medical presentation, but it's great to know that we have soldiers like you on the line fighting for us. So thank you very, very much on behalf of our viewers and on behalf of the people that you treat. Thank you.
Thank you.
Shannon, we're down to the last 2 minutes of this show, so I want to let you do your little presentation as to why people should be calling the Nurse Connect program. So go at it.
Yeah, so a lot of them are calling and they are concerned about COVID, but it turns out sometimes it turns into a different underlying health issue. And like Dr. Bustamante said, the health issues aren't just going to stop. We still have people that suffer from strokes, heart disease, renal failure. They have to go get dialysis. Some that, are COVID positive, but they have diabetes and, they call and they end up being admitted, but they were scared to even go to the hospital. And the nurses, because they have a lot of ER experience, and trauma too as well, are able to say, no, don't be scared. You need to go. And then it was the right decision because a lot of them have been admitted to the hospital after speaking to us. And then honestly, just educating decreases the community's anxiety, and we educate for the CDC and make sure that they're still managing their care properly during COVID.
What telephone number does one use to get to Nurse Connect program?
The telephone number for Nurse Connect is 954-320-5730. And they could also be transferred to us. And in the future, when we do the telehealth app that they're starting to organize, they'll be able to go through the nurse as well and get to us that way.
All right, repeat that telephone number one more time.
954-320-5730.
Okay, thank you. Well, thank you both very much for being here. This is a difficult time for the public. The viewers are the ones who basically ask the questions. I'm just sitting here trying to ask what they've asked us to ask. So thank you, Shannon Heiss, registered nurse, and you're the lead nurse, which means that you're the top dog there, in the Nurse Connect program at Broward Health. We appreciate your hard work. Dr. Bustamante, all I can say to you one more time is that we thank you for being not only the quality vascular surgeon that we know of, but also for your humane caring for the community at large. Obviously, we know you take good care of your patients, but everything that you said today leads to the community to pay attention that this virus is not going away and that we need to be cautious and we need to be connective in our own minds to wear masks, be socially distant, wash your hands, and use some common sense. So thank you, Dr. Bustamante, for appearing today, and do well. Thank you one more time. Thank you.
Thank you.
Well, folks, we tried to give you some insight into what's going on in the community and with our healthcare workers relative to this insidious COVID-19. Hopefully we've answered some of your questions. If we didn't, there's a telephone number and an email address right here. And I always tell you, you got to take good care of yourself. Don't just put it off to the fact that, you know, all of a sudden you can't smell something or you can't taste something or you have gastric problems and you have high fever and it'll go away. No. Communicate with your health professionals. Help them help you. So remember, I always tell you to take good care of yourself. This show is called Dateline Health. We come to you from Nova Southeastern University. Until next time, my name is Fred Lipman. See ya.